My name is Jason Schuster. I'm a doctor of physical therapy. Before that, I was a fly fishing guide in Patagonia, Chile for a decade. Now I own a continuing education company teaching other doctors how to do a couple things, including dry needling. This is a part of my online dry needling class, Online Dry Needling 1, Dry Needling in the Autonomic Nervous System. This is about how to specifically target the autonomic nervous system with dry needling. This is a great course, you guys. You can check it out on our website, intricateartseminars.com. 7 easy tricks to maximize autonomic nervous system homeostasis and improve neuroplasticity of dry needling. This is a really important aspect of dry needling. It's what this whole class has been about. And I have tried to put down, in general, you guys, some easy, just overall ideas to think about that will lead to inducing more autonomic nervous system homeostasis each time you treat somebody, which maximizes the chance that their body and brain has to optimize health span, which optimizes lifespan and just improves everything about life. So, number 1, use more needles rather than less to treat as much tissue pathology throughout as much of the body each time you treat somebody as possible. So, remember, in general, it's just the overall effect of needling. It has an autonomic, homeostatic effect on the body. So if you're sticking needles into tissue that is pathologic at all, and it's very hard to find tissue on people that has no pathology, that couldn't use a little bit of normalization, or that's not a little bit short and hypoxic, any needle that you stick into tissue pathology is improving the overall energy producing capability of those mitochondria and mitochondria throughout the body, which is improving autonomic nervous system homeostasis, which is taking you into either out of energy deficiency or giving you more reserve energy, which gives your body and brain the superpowers, which gives your body and brain access to the superpowers that they have to maintain health and to improve health, you guys. So use more needles rather than less. To me, the only too many needles is making somebody go vasovagal, right? So that is one of a good indication. Needle bilaterally, number 2. Needling bilateral, we know that all of our nerves cross over. We know that if you poke the left side of your body, the right side of your brain really lights up, but the left side of your brain also lights up a little bit. So needle bilaterally, that's a really good thing to do. I don't needle as heavily on the unaffected side, but say I'm treating a shoulder, you guys, I usually try to needle at least the most aggravated areas bilaterally. So I needle the parasympathetics bilaterally always, and then I always try to at least needle bilaterally on the most aggravated needles on the most affected areas in general. Leave the needles in longer rather than shorter, number 3. That is one of the easiest, most effective ways to maximize treatment efficacy, is just leave the needles in longer. Remember, something happens to the autonomic nervous system in as much as like the sticking power, or the number 1, the amount of nervous system homeostasis that is achieved when you leave the needles in longer is better. And that amount of autonomic nervous system homeostasis that you achieve seems to stay a lot longer if the needles are left in the body as that process happens. This has not been specifically researched. I don't think it's even really possible to get a really clear understanding of this right at the moment, at least with our technology. But we can see some general effects. We know that it takes on average about 20 minutes for the autonomic nervous system to go from the sympathetic spike to parasympathetic dominance. There's something that happens if you leave the needles in while that process takes place, and then afterwards up to a certain period of time. So at least right now, my best guesstimate is there's some point of no improving return at around 60 to 90 minutes for a lot of people when the needles are left in. So I try to leave my needles in for 60 to 90 minutes. Number 4, connect the right spine to the left spine and vice versa. So again, the EMDR psychotherapy uses bilateral low-frequency stimulation. So I talk about needling bilateral, also use the electrical stimulation bilaterally, and I like to do red to black on the same channel, crossing the spine, low frequency. that seems to do something to significantly improve the neuroplastic effect of needling, which allows the autonomic nervous system to achieve more homeostasis, which allows your patient to achieve more health, which is what we're going for. Number 5, connect the spinal level through the multifidus to the distal end of the nerve path, including whatever tissue pathology in between that you can find. So no matter what, if somebody comes in with a right elbow problem, no matter if they complain about their right hand or the right side of their neck or the left side of the neck, I'm going to always treat the entire nerve path. So I'm thinking, okay, what innervates the right elbow? Okay, where do those nerves come from and where do they end? And I at least want to have a needle at the beginning of the nerve path, at the end of the nerve path, and as much in between as we can, and do it bilaterally and cross the spine with stim. That all helps maximize the outcome of treatment. So I always try to think, you guys, all these little tricks, if we add them together, you can really, really amplify the overall effect of the needling. And that is what number 7 is about, which we'll talk about this. Number 6, target the parasympathetics with your first needles. This is super duper important. We talked about this, you guys. That puts a dampener on the amount of initial sympathetic spike you get from your other needles. It shifts the nervous system to parasympathetic dominance faster. It allows the nervous system to recover more fully. That recovery stays longer. You get all sorts of extra beneficial effects of doing this. Patients are more comfortable during treatment. The needles hurt less. The outcomes are better. Just everything about it is better. So target the parasympathetic with your first needles, the ears, sacral area, cranial suture lines, all that good stuff, and then move on to treating whatever else you're going to treat. You'll see a big improvement in your outcomes, and your patients will like the treatment a whole heck of a lot better. And then, like we've mentioned a couple things so far, you guys, following needling treatment, I like to do other things too. So I don't just needle. I like to needle, and then I do my joint manipulations. I like doing things like cupping and other things like that. I love to add other treatments that act similarly on the autonomic nervous system and the mitochondria. So red light therapy is super awesome, very, very helpful for mitochondrial health. Things like red light saunas, regular saunas, heat, things that go along with needling well. I don't like to do ice, you guys, because ice has kind of the opposite effect of needling, right? So if I'm going to do ice, I like to do ice first, and then I'll do heat afterwards. Stretching is great. Range of motion is great, just nothing strenuous after the needling, because with the needling, we're shifting the nervous system towards parasympathetic dominance, and then we don't want to go afterwards and do something that's going to re-stimulate the sympathetics. So adding in other treatments is very, very helpful, including joint manipulation, getting all the joints back to neutral, normalizing the sympathetic chain. That's all very, very important. Thanks for watching, you guys. To continue this video, make sure to keep an eye on my channel. There'll be many parts to this series. This is part of our online dry needling 1 course. We have 2 online dry needling courses. We have a live online dry needling course, and we have a bunch of in-person dry needling courses, all board certified and accredited. If you want a discount on our online dry needling courses, check out our school community. It's school.com/CEU, SKOOL.com/CEU. You can get a discount there on our online dry needling courses, on our online nutrition courses, and a whole bunch of other good stuff. I have weekly Zoom meetings there. We have a private community chat room. It's a really awesome community. Check it out. Thanks for watching, you guys. See you next week.